Welcome to Cardiovisual. I'm Seema Mather. I'm so excited about this morning because we are going to learn some breathing techniques that can potentially help cardiovascular health. These are pranayama techniques and they originate in India. They're thousands of years old, but modern science today is validating the impact. And both of these worlds, they come together for Dr. Amit Anand, who has been exposed to yogic traditions since childhood and been a pulmonologist and sleep doctor in Boston for 35 years. And Dr. Anand, you created Breathonance with incredible musician Clint Valadares from Berklee College of Music, who we see over here in his rock star outfit. And then together, you both have incredibly brought this breathing exercises together with music. And we're so excited because we're all going to learn these breathing techniques this morning. But before we go into this first of a series that we're kicking off here on Cardiovisual, Dr. Anand, tell us, because this is what is so fascinating about the way that you're doing this. Can you tell us how you bring medicine, what you've learned, your scientific knowledge together with these breathing techniques and breathonance?
Well, thank you so much, Seema. It's wonderful to be here with you, Cardiovisual, with Clint, my brother in Breathonance. Just to talk about breathwork and its value in our day-to-day lives. As you said very rightly, I'm practicing as a pulmonologist, a critical care physician, and a sleep medicine doctor in Boston. And breathing is the glue to all my subspecialty training. But having grown up in India, yoga surrounded me. It was all around us. In fact, I was given my mantra when I was 5, not even knowing what it meant. And I learned a little bit about the tradition just through my mother, my grandfather. Fast forward, coming to America, I re-credentialed in the Western paradigm over here. I was fascinated with breathing physiology. But there was a part of me that still yearned to express itself, and that was the yogic tradition of pranayama and asana and mantra. And during fellowship, I was intrigued, started to research this, started to study this, not only on myself, but with patients who couldn't breathe. And it's now come full circle in terms of these worlds colliding with each other, hopefully in a very powerful synergistic way to help
You know
our
what I love?
patients.
I love about your experience too, and what you're bringing, and you're going to teach even this morning, is that you're bringing these old traditions that even when you study pranayama or you do these breathing techniques, we're often told you shouldn't do a certain technique if you have a condition, and this is from ancient knowledge. But now you are teaching us this safely and can actually point out what is good for different patients, correct? Or people in general, or who should be careful from certain techniques.
Absolutely. Breathing can be a real good friend, or it can be a very dangerous foe because you start to manipulate different breath rates, oxygen, CO2, blood pressure, heart rate, and you can create states of euphoria, panic, and even calm. Whatever I'm going to be teaching through this series and what we've launched on Breathonance as our platform is safe, is scientifically validated, and there will be times when I'll tell you exactly, well, this is meant for this. This is probably not the right time to do this breathing technique, but it's all validated, it's all safe. So be rest assured.
So today, what are we going to learn, and how should we all get ready to practice along with you?
So today's technique is going to be about learning to master slow breathing, slow breathing. In fact, if I had to crystallize all of pranayama the way I've experienced and taught it, pranayama is about using the instrument that is breathing to manipulate energy within our system. Prana, energy, yama, control, off. And there are many pathways to pranayama. Turns out that the act of breathing is a very safe, it's a very tangible, and it's a very consistent way of enlivening that aspect of energy within our awareness. It modulates its magic through the autonomic nervous system by creating balance between sympathetic and parasympathetic sides of the axis. And it also serves as the platform for other practices such as inward attention, pratyahara, concentration, focused, which is dharana, and meditation, dhyana. However, pranayama is not meditation. It can be meditative, but it's not meditation. It is work. And I'm going to have you work your breath over the next few weeks to give you a glimpse of how slow, deep, initially large volume and then slow volume breathing, upright posture, nostril over mouth dominant breathing can create magic in human physiology. First practice is going to be about the ha breath, or in pranayama, they call the Ujjayi breath. This practice is done by creating an emphasis on the exhale. And that's where the work is really in breath work, right? The act of breathing is normally a passive inhale, an active inhale and a passive exhale. When we shift our attention to the exhale and bring activity to that stroke of the breath, we can start to create slow frequency resonant rhythms. This technique is done by creating a sound on the exhale, so a certain vibration on the exhale, very similar to as if you were fogging your eyeglasses on the exhale. And that fogging sound is a slow, uniform sound throughout the exhale. We're not rushing to fog our eyeglasses on the first couple of seconds. It takes 4, 5, 6 seconds on the exhale, slowly. The nostril inhale is silent. The exhale is through the mouth initially, and it's resonant. You create that vibration on the exhale. Once you master that sound, and that sound is very similar to almost the waves lapping up on the ocean, the sound of the wind rustling through the leaves of the trees in the forest, that sound of water gushing through the pipes in your neighbor's apartment in the basement. That's that sound of. Once you master that sound through the mouth, then I'll have you whisper it. So it's say it softly with the mouth open, but a little closed. So it'll be a nostril inhale. Again, a full, uniform, slow nostril inhale throughout those 4, 5, 6 seconds. And then a whisper. So you can still hear that sound. It's coming from here. It's coming from the vocal cords. There's a slight constriction at the level of the glottis so that you can hear that sound on the exhale. And finally, when you master it on that whisper, where it's very soft, almost imperceptible to anyone else, but it's still very vibrant to you, then you start to repeat that sound with the mouth closed, but through the nose on the out breath. So it becomes a silent nostril in, and now a resonant nostril out. Again, uniform, all from the beginning of the exhale to the end of the exhale over those 4 to 6 seconds. And then you get into a rhythm. You get into a rhythm, and the music serves as your metronome. The two important principles when doing this practice is to have uniformity of breath all the way from the beginning of the exhale to the end of the exhale across those 4 to 6 seconds, and uniformity on the inhale. Once you become comfortable with the resonant nostril exhale, that will guide the depth and the duration of the silent nostril inhale. You don't need to stack up because you're slowing the breath down on the exhale. So sometimes there's a tendency to, oh my God, I'm not breathing. Let me fill up on the inhale. You don't need to do that. Should you do it, you will start to get hyperinflated over 3 to 4 breaths, and you'll get a sense of discomfort or panic. So a little bit of an inhale, a slow resonant exhale all the way out. So less is more on the inhale, paradoxically, as you slowly breathe out with that sound on the exhale. So that's the ha breath, or the Ujjayi breath. Are we ready to do it together? All right, so let's sit tall, close the eyes, bring the awareness within. Bring your attention to your breathing. Nostril in. Nostril out. Slow it down. Nostril in, silent. Nostril out. And now we'll start the practice. Nose in. Mouth open, ha. Slow. Nostril in. Mouth, ha. Slow it down. Nose in. Uniformity throughout the exhale. Nose in. Nostril in, silent. Exhale, mouth resonant. Nostril in, silent, and now we'll whisper. Nose in. Whisper, ha. Nostril in, no need to stack. Slow it down. Nostril in. Whisper. Nose in. Slow. Whisper. Resonant. And now nose in, and the next exhale will be nose out. Feel that sound at the throat. Nostril in. Nostril out. Hear it. Nose in. Nose out. Nostril in. Resonant nostril out throughout the exhale. Nostril out. Sit tall. Nose in. Nose out. Nostril in. Feel it. Nostril out. Nose in. Nostril in. Feel that vibration. And release from the practice. Just coming back to normal breathing. Watching the breath rather than making it happen. Watching the body. Feeling the mind settle. And as you feel ready, just gently open the eyes.
That felt so great. So good. So I'm so excited to see what the what everybody else thought that was following along, and so we're looking forward to your questions that are coming in. But in the meantime, I'm curious about what was happening inside of the body, and then especially when you took us through the exercise, and it felt like a certain number of times that we were doing solely the nose, and then a combination, and why that to have an impact.
So this practice is generally done with the mouth closed. The only reason I started teaching this with the mouth open is so that people could actually appreciate the sound.
Mm-hmm.
When you have that sound of ha uniformly on the exhale, you feel the glottic constriction. It's coming from the vocal cords because that's where phonation, that sound, speech is created on the exhale.
Mm-hmm.
And it has to be a soft ha. It's not a strain. It's not coming from below the clavicles. It's not coming from the tongue. It's not coming from the sinuses. It's not effort. It's not a wheeze. So once you get comfortable with that on the mouth, then you internalize it gradually through the whisper and through the nostril exhale. Once you've learned this sound, you don't need to do it with the mouth open. It just becomes a nostril practice because pranayama
Mm-hmm.
is really about emphasizing nose over mouth.
And how is this one helping our heart?
So these breathing frequencies, I mean, that was a 6 second in and a 6 second out, Seema. So you're
Mm-hmm.
practicing breathing at 5 breaths per minute. Normal breathing is anywhere between 12 to 18 breaths per minute. But just by bringing attention to the exhale, creating that sound, you've slowed the breath down. When we slow our breathing down to between 4 and 7 breaths per minute, we are in resonant frequency rhythm. We are in resonant rhythm. And what do I
Mm-hmm.
mean by that? Well, it's important to understand the phenomenon of resonance because it's out there everywhere. The example of an opera singer shattering a glass with her voice, that's when the resonant frequency of her voice is very similar to the resonant frequency of the glass. Soldiers walking across a bridge, they're asked to walk out of step so that the bridge doesn't crumble. The boom in your car playing with the windows closed, the car starts to reverberate, another example of resonance. So when the frequency of the forced system is very similar to the frequency of the output system, the amplitude of the forcing principle on the output principle is maximized.
I see.
And
Mm-hmm.
that's what happens with breathing and heart rate. When you're
Mm-hmm.
breathing at 12 to 16, your heart rate increases with inspiration and it decreases with expiration. It's normal. Everyone has that. It's called respiratory sinus arrhythmia or heart rate variability. As soon as you start to slow the breath down into resonant rhythm, at frequencies that are between 4 and 7, there is a maximal gain of heart rate. So the heart rate variability
Wow.
maximizes across respiratory rhythm because there is maximal output of what's called the cardiac efferent vagal system on the pacemaking mechanism of the heart, the sinoatrial node, where acetylcholine, which is the neurotransmitter for the vagus nerve,
Mm-hmm.
acts on the pacemaking system to maximize its effect. So those breathing frequencies, that neurotransmitter, the vagal efferent output is maximized. And so you have
Amazing.
maximal heart rate variability. And heart rate
Mm-hmm.
variability, when it's high, is actually good for us. We now know that
Mm-hmm.
HRV, when it's amplified, whether in the waking state, through practices like this, or in the sleeping state, can have profound benefits and can be predictive of good cardiovascular health, good sleep health, good autonomic health, pretty much across the board.
So we're getting a question in of someone who's asking, how can I practice this in my daily life, day to day? And I also wonder, adding on to this great question is, should it be every day to get these type of benefits that you're talking about?
Yeah, so we've actually launched Breathonance as our platform where all of these techniques are housed. There is a lesson plan out there, of which this is the first lesson, Breathfully Slow. We call them lessons in breathfulness. It's a little play on the word mindfulness. You learn all of this online. I mean, you can take any breathing app, but as long as you're practicing within that frequency, you're pretty much using a metronome to pace your breathing. We use music to pace ours.
Mm-hmm.
And so in time, you will find that the effect of this practice, even though it's maximal when you're doing it, it starts to resonate outside of it. And the
Mm-hmm.
more you do it, the more the resonance outside of the practice. You become a slower breather. Your heart rate drops. Your blood pressure drops. Your gas exchange actually improves by 15%. You become more of an efficient breather. This is not coming at the cost of oxygen deprivation by any means. But there's another magical aspect of this, is that you become an upright and a calm and a clear and a peaceful human being. So there's many benefits with practicing resonant frequency breathing rhythms,
So
but
it's not
Breathonance
just
is our platform.
the impact that's happening in the moment that you do it, but it has a prolonged effect, right? Um,
Correct.
and that gets to another question that I'm seeing here that says, with how often and is there a time of day that they're asking is that's preferable to do this?
These are wonderful questions. I mean, the science on this has started to explode over the last few years, obviously, because we all
Mm-hmm.
went through a collective asphyxiation over the last few years
Right.
with COVID. It turns out that even a 5-minute practice of breath work, and there was an article published in Science, which is one of the most reputed medical journals out there, by Andrew Huberman and his group in Stanford, where even a 5-minute practice of what they called cyclic sighing, which is in essence what you just learned. Cyclic
Mm-hmm.
sighing is how the ha breath or the Ujjayi breath can modulate mood and arousal after 6 weeks in a positive way. Not only does it do it when you're in the practice in terms of respiratory rate, oxygen, heart rate, blood pressure, but it starts to resonate outside of it in a duration as short as 6 weeks, 5 minutes a day.
How is it that that breath work that could be 5 minutes a day has that long-term impact?
So this is what we call the state versus the trait principle. It's just like building a habit. You
Mm-hmm.
go to the gym, you work out, you lift weights. Over a period of time, your muscle will start to bulk up. You're
Right.
developing a rhythm, but this is through the nervous system. And the autonomic cascade starts to shift from fight and flight to calm, restorative, peaceful, parasympathetic, sympathetic to parasympathetic. And
Right.
in time, that state starts to become trait. Um, Turns out that 5 to 10 minutes a day is good enough. And that's not a
Mm-hmm.
big ask.
No.
People say, oh, I don't have the time. Well, if you don't have the time, you probably need to do it for 20 minutes.
So going back to the question when somebody said, what time of day? What is the best time of day?
So breathwork can be done at any time of day, but it's best done in the morning,
Mm-hmm.
especially after you have gone to the restroom and evacuated your bowels.
We'll leave it
It's
at that.
best done on a light stomach, because
Okay.
when the stomach is light, the diaphragm starts to move with vigor. The
Mm-hmm.
belly starts to move with vigor. Gas exchange suddenly becomes very, very tangible in your experience. So in the morning, when sleep has happened, when you are fresh for the experience of this practice, it's the best time, but always on a light stomach. In fact, I say you can do it anywhere, anytime,
Mm-hmm.
but please don't do it on a full stomach, because
Okay.
otherwise you won't feel the power of the practice.
Also in that and feeling the power of the practice, when you ask us to sit straight, right? Or of your spine being straight, that's how important is that to get maximum result?
Huge. That's a very, very important point, Seema, which I will probably address in a few weeks from now when we talk about posture. Pranayama is about refining your posture. Also, secondarily, it's a side benefit. In fact, the more upright the spine, the more free the rib cage, the more efficient gas exchange. So you'll always find that, when people are doing pranayama in India or in yoga studios, they don't sit against a backrest. they're upright. Their hips are slightly raised vis-a-vis their knees so that there's no strain on the lower back.
Hmm.
The spine starts to cultivate this expression of uprightness, and uprightness in the practice begets uprightness in life.
And we should also, prepare people as we do this series how they can position themselves, how they should be sitting before they start, and what props also some people can use that it might be hard for some people to sit up straight on their own. Do you have some suggestions on what people can do to get into the position comfortably if they are not able to sit up straight by themselves?
Yeah, so any comfortable chair is completely fine. All I would say is keep the buttocks elevated vis-a-vis the knees so that there's no strain on the knees. If you're doing it a drift of a backrest, just keep the hips elevated vis-a-vis the knees. There'll be no strain. Um, in terms of some people can't do it, well, if you have to sit back, by all means, sit back. I taught people with interstitial lung disease and COPD and a study a couple of years ago at University of Washington. Some of them were on hospice,
Hmm.
on supplemental oxygen, but they
Wow.
could still breathe. It's the one thing that we do when we're born into this world. It's the last thing we'll do when we leave. But even when we are deceased, we can still take control. Just
Hmm.
make a habit of it, no matter what. Even if you have to sit against the backrest, do it.
Okay. And we have someone asking, are there specific patients who would benefit from this? So I guess we should talk about this particular one that we did, who could benefit, and then a little glimpse into the future, other patients who could benefit from some of the other exercises.
So, as I said, this series is going to give you glimpses into a breathwork practice that is safe for every human. What you are doing is you are modulating autonomic tone from sympathetic to parasympathetic. People who are hypervigilant, who are aroused beyond arousal, and it manifests in their physiology as hypertension, arrhythmia, breathing states, asthma, even COPD, chronic pain, people who are anxious, people who can't sleep at night for insomnia. Everyone can benefit. In fact, tell my patients that if there's one practice that you had to learn amongst all the techniques, this is it.
Hmm.
The Ha breath. A 5-minute practice once or twice a day can be transformative in terms of your physiological health and, more importantly, in terms of your psychophysiological propensities for wellness and disease.
And it really, I mean, we're not taking the breath and focusing on the belly in this one, right? It's like it real so much of it is really here. We're keeping it in this particular area.
Yeah, you start by creating the constriction of the cord on the
Hmm.
exhale so that you hear this sound. That sound itself is soothing to the nervous system. And we'll get more into that with music and sound in
Hmm.
a few weeks from now. But that sound soothes the nervous system. It's created right here, and it becomes a soft vibration on the exhale. It's so soothing that in the beginning, it's a little bit of an effort, but then after that, it becomes involuntary. I've found myself, when I'm walking, I'm doing this practice. Sometimes when I'm riding my Peloton bike, I'm sometimes breathing to this. And I've certainly noticed this in the ICU when I'm in the midst of a code or intubating someone. I'm suddenly aware that, hey, I'm breathing that way. And it's kind of centered me. It's kind of made me a little more calm and made me much in tune with the task at hand.
I love also that when you talk about the vibration, because that is an aspect also that we don't think that much about, but there's the vibration in the breath. And that's also why you have put it to music. One of the reasons you put it to music, right? With Clint focusing on that subtle vibration of breath.
Yeah, vibration is key. Turns out sound is one of the most subtle of our senses. It's in fact even more subtle than light, than
Hmm.
vision. And when you introduce that volitionally with a practice like this, with breath, it can create magic. Obviously through the autonomic nervous system, but on many aspects of our being, emotional, intellectual. That's why we all love music. We all have our lists that we train to. We sometimes even do before meditation. And certainly breathwork can be a powerful adjunct to music, as is music to breathwork.
So wonderful. So we had our interview that we did together, the first interview on cardiovisual, where we went more into your background and Clint's background. And I hope that anyone who's interested in that will go back and watch it. But most importantly, going forward, is this series that we're doing over the next couple of months of a little bit. It's like the appetizer to breathonance of different exercises for different parts and helping different conditions. And so, what can we expect next?
Well, if you liked what you felt today, because this is also about feeling, not just doing it, but our tagline is breathe, feel, transform. You have to feel it. Or we have some videos up on YouTube on the Breathonance channel. It talks about this, and there's different ratios and rhythms to which you can practice. Go ahead and check it out. And if it really piques your interest, or come back next time, but be sure to visit breathonance.com.
Great. And you know what's good about these little appetizer chunks is that we can start to feel it and also understand how the 5 minutes or 15 minutes, how even just that little amount can have an impact. And I have to admit, I mean, I'm a very often a 5-10 minute breather in the morning, so I don't do it for that long. But I also agree with you that it's even a short practice over time can really have an impact. So I'm excited to learn more from you and to share with everyone. We're doing these about every other Wednesday here on Cardiovisual. And here you see Clint popping back up again. And we will go more in the next couple of ones to understand a little bit more about the music and how that specific music and the tones and how that has an impact, as well as, if everyone didn't notice already, how doing this to the music helps and it makes it easier. And as Clint was explaining before too, that it's a natural beat that you put in, right, Clint?
That's right. That's right. It's more about the soul, connecting with our soul and the rhythm of our body. If we connect with the rhythm of our body, there's no other better rhythm to keep us on pace, because this music will support your breath work. That is where the work is.
Awesome. Well, thank you both for sharing this with Cardiovisual's wonderful audience and with me. And I hope everyone will come back again and we'll do it again soon.
Thank you, Seema. Thank you so much.
Thank you, Seema. Really appreciate it.